The number of COVID deaths recorded in the past 24 hours in the UK was more than 1,800. That's yet another record since the pandemic began. But more than 4.5 million people across the UK have now received their first dose of a vaccine. The pressure on the NHS is still extreme, and our latest report on hospital staff this week is from the Royal Derby Hospital. Our medical editor Fergus Walsh, producer Nikki Stiasny and camera journalist Rob Taylor compiled this report.
I've been in nursing for 33 years and I have never seen anything like this.
In all honesty, it is physically and emotionally exhausting.
I don't think anybody feels that we've seen the worst of this yet.
If we carry on this trajectory, we'll be completely overwhelmed in a couple of weeks.
The warnings keep coming, and not just from London. This is the Royal Derby Hospital. Nearly half its patients have COVID.
CPAP mask on for a couple of hours.
Paul Robinson is 50. He's terrified.
I had an horrendous night, and I won't lie, I messaged my wife this morning to say that I wasn't so sure if I was going to survive. We've just bought ourselves a new beautiful bungalow which we're supposed to be moving into, and it's our dream, and I may not see it.
The intensive care unit has doubled in size and is still growing, but they've already had to transfer some critically ill patients to other hospitals.
This time it's been a perfect storm, really, of the new variants arrived, we've hit winter at just the wrong time, Christmas has arrived at exactly the worst time it could have done, and there's just been a steady, inexorable rise of cases. We are still on the up ramp of the patients coming through.
Check the length on the remaining lines.
Caring for those patients places huge demands on staff.
1, 2, 3, floors.
Every ICU uses this procedure, proning, turning patients on their front to help their breathing.
This is the very definition of intensive care. All over the country there are medical teams like this one trying to keep thousands of COVID patients alive. All that and coping with other winter pressures as well.
There is light amid the darkness. Treatments are getting better. Steroids and some arthritis drugs have greatly improved the chances of survival. But to provide care, you need staff. So many are off sick. Those left are drained. On one shift, nurses had to walk past COVID deniers demonstrating outside the hospital.
We've got staff who are absolutely exhausted and traumatised. A lot of staff are struggling with their mental health. The nurses are coming in and working extremely hard. A lot of them are doing extra shifts. They're all exhausted. And then to see protesters saying that it's not real, for the nurses then to come in.
Those on the COVID front line say if the public could see through their eyes, they'd take more care.
It's not a hoax, it's very real. People are dying daily within the hospital, and I myself have held the hand of patients that are dying within the department. I think people need to take it a little bit more seriously, and I don't think they're aware of the impact.
The emergency department has separate entrances for COVID and non-COVID patients.
Thank you, bye-bye.
Like scores of other hospitals across the UK, they're approaching their limits.
If we reach a point where the hospital is so full that we can't get patients out of the emergency department in a timely fashion, the whole system down here comes to a halt. And that's when we start holding patients on ambulances. That's where we start to see the real risks of patient harm creeping up in the emergency department.
There is a path out of the pandemic via the vaccine, but the benefits won't be felt here for many weeks. For now, hospitals are bracing for worse to come. Fergus Walsh, BBC News, Derby.
We'll talk to Fergus in just a moment. Before that, let's have a look at the latest official government figures, which are revealed today, showing that there were 38,905 new infections recorded in the latest 24-hour period, which means that on average the number of new cases reported per day in the past week is 42,026, and as you can see on the chart there, that's been falling. Across the UK, an average of 39,068 people were in hospital with coronavirus over the 7 days to Sunday. That includes suspected cases in Wales. 1,820 deaths were reported. That's people who died within 28 days of a positive COVID test. As we've heard, that's the biggest single total reported so far. On average, in the past week, 1,218 deaths were announced every day. The total number of deaths so far across the UK is 93,290. And let's get a quick update on the programme of mass vaccinations. 343,163 people have had their first dose of one of the 3 approved vaccines in the latest 24-hour period. That's the most yet in a day. And it takes the overall number of people who've had their first vaccine to 4,609,740. So as promised, Fergus is with me, our medical editor. In your report there, Fergus, where you talked to staff and those involved, you then said braced for worse to come. What did you mean by that, and what can viewers understand by that?
Well, the appalling record death toll today, Huw, surpassing another record yesterday. Each one, someone being mourned tonight by family and friends. The UK has the highest COVID death toll in Europe, the 5th highest in the world. And it underlines yet again that with this new, more transmissible variant, we are in a more precarious, a more fragile position in terms of controlling the virus than at any time in the pandemic. Many of those who have recently died will have been infected around Christmas time, but it wasn't until the end of December and early January that we saw that huge surge in cases, and that is only just beginning to feed in to the daily death toll. At some point in the next week or two, we should mercifully pass the peak, but the numbers dying and in hospital are going to remain very significant throughout winter. The one solace is that the protective effect of vaccinating the most vulnerable will before long begin having a positive impact.
Fergus, many thanks once again. Fergus Walsh there, our medical editor.